You're watching the Microsoft US Health and Life Sciences Confessions of Health Geeks podcast, a show that offers industry insight from the health geeks and data freaks of the US Health and Life Sciences industry team. I'm your host, Claire Bonacy. On episode 2 of the 3-part patient experience series, guest host Antoinette Thomas discusses health plan member experience with our Director of Population Health, Amy Burke.
Amy, thank you for joining. As we get started, it would be great to share a little bit about yourself with our guests.
Wonderful. Thank you so much for having me, Tony. So I am the new Director of Population Health at Microsoft. I bring forth clinical and operational experience in the population health realm or ecosystem. I started my career as a nurse, so I am a clinician by background. And after graduate school, I embarked on a career in consulting. I'd been a healthcare consultant for 15 years, and the span of my work is across payers and providers, looking at innovation of care delivery models, working domestically and internationally, working in the public and private sectors. So I feel that my experience is broad, but also very focused on population health.
So I'm really glad to be working with you, and as the person that's really responsible for developing the point of view on experience for health and life sciences, I think it's really important to, work with all my colleagues on the industry team across their subject matter to make sure we're developing a holistic view of experience. And so if you would, can you share a little bit about traditional member experience and what drives improvement of that experience inside health plan or per the purview of health plan? And the second part of that question is, does consumerism play a role?
So thank you so much for that question, Tony. I've had some time to think about that question. And in my mind, the traditional role of the member in a health plan is one that was very reactive versus proactive. We have care managers that are reaching out to engage our members in these programs. Oftentimes members aren't even aware of these programs. So how can the health plan really be more keen on outreach and targeting members for these type of programs, hence care management, behavioral health programs, pharmacy programs, et cetera. And even in the role, or pardon me, even in the traditional realm of care management, it has been very much a telephonic model. And how much impact can we have over the telephone versus how can we engage our members through digital mechanisms, digital modalities, like virtual, like digital, et cetera. So really, harnessing in on engaging that member more through more creative technologies. And I would say also that it empowers the member then to really have a responsibility to, take care of themselves, right? We are putting the member in a place of power to really be able to, engage, to be proactive with their own healthcare. And I forgot to mention, but this is an important part as well in terms of, what's out there in terms of remote patient monitoring. So, really putting the onus on them to take care of their health in a way that they haven't done before. And that spans across the entire continuum of health, and I would say even the entire continuum of demographics through age and culture and gender, et cetera. So I think it's really a good place for any consumer to be right now, because consumers today have choices like they hadn't had before. You can go on the internet and consumers can look up and really have a clear picture and understanding and knowledge of their disease course, of their condition. They have knowledge of who their providers are against other providers. They can now look up. Price transparency is becoming very prominent in terms of being able to look up costs. So that's very important to consumers today. And I think that, putting our consumers at the heart of what we do, both from a chronic care management perspective as well as a member satisfaction perspective, becomes quite important.
So in the hospital world and the clinic world, we have, the HCAHPS measurements that that measure how satisfied a patient might be within certain realms of that experience. How do health plans solicit feedback from their members to understand how satisfied they are with the experience that they're having within their care management program or within the health plan itself?
So there are a couple of ways in which that happens. So there are age caps that apply to the member experience in a health plan. Also STARS, so that's a CMS quality measure for Medicare programs. Member satisfaction is actually now weighted most heavily in those STAR measures. And thirdly, then, through surveys that are solicited to members through their net promoter scores, et cetera, that become quite relevant in terms of measuring member satisfaction.
That's great, because I know some of the listening audience might be Microsoft Health and Life Science field sales teams who are really trying to understand a little bit more about how satisfaction is rated. So that's helpful to them in their daily jobs, like certainly to understand specifically the star ratings that you referenced. Something that I'm personally interested in, and I think our audience would be interested in, is the comparison or contrast between what healthcare system patient experiences, and I think most people understand that, and health plan member experience. So if you could, give a little bit of that picture of what that looks like, that'd be helpful.
Yeah, so I would say that, a patient versus a member, if we want to put it in that perspective, a patient is often going to the hospital for reasons in which they need to be taken care of, and they become a guest at that hospital, and that they're being taken care of by nurses, and there are physicians there that are treating them with protocols, etc. Um, and often this is in a place of sickness versus in health, right? So a patient is sick, and that in itself brings in a cadre of emotions and experiences of that patient in the hospital, right? Where once that patient goes out of the hospital, is discharged from the hospital rather, their disposition to a post-acute facility or to home, and they're within an environment that they're now on their road to recovery, and they're well, and they're getting healthy, or healthier, shall I say. And it goes back to that first comment in which I said, where the member has more, I would say, power, more, ability to manage their condition, right? And this is where it becomes so important for our care managers that are out there to take a proactive approach with our members to engage them better in their care, so they can have that opportunity to self-manage their care for better outcomes. So, now it's more proactive, and I would say, where I said the patient is a guest of the hospital and that everything is directed by this interdisciplinary care team in how they deliver care. Now it becomes a little bit different of a shift to, now the care management team, the interdisciplinary team, is a guest to that member's home, even when the person or the member goes to see their provider. It's still a different dynamic, right? Because I think that member is at the heart and the center of making key decisions, and shared decision making. And that applies too to the provider side, right? There should be shared decision making in the hospital setting as well. But I think it's even more elevated in the post-acute setting, in that members are on their way to becoming healthy, and a member has control over that pathway more so than a patient, if that makes sense.
It does. I think that's really profound. And it's also very interesting, Amy, because some of the things I've been doing a lot of reading and research on agency, and like a personal agency. And I think what we're seeing right now with patients, consumers, customers, members, is that they're exhibiting more personal agency than they ever have before. People who study this aren't really certain as to why that might be. I don't think there's one reason for it. I think there's a multitude of reasons. Having access to information, technology, and also the fact that we have been living 12 months inside of a pandemic where they really feel that they have to take control over their own health, their own wellness, their own decision making. And so what I'm starting to see in the provider or the healthcare system space is really kind of this movement that you were referencing about being a collaborator with someone in their health, knowing that person personally to offer the guidance that they need to make the decisions about their health. So I'm really starting to see healthcare systems want to move in that direction, especially on how they're communicating with patients, either who are trying to make appointments or soliciting some advice on hospitals. And it's just really interesting paradigm shift. So I'm excited to see what happens there. I think it's important. And then lastly, what important lessons can the healthcare system world and the plan world learn from one another to improve this experience?
Yeah, so thank you for that question. And this, again, centers around we have to focus in on patient member-centric care. And what that means, and including the member in terms of, or the patient, what matters most to them in terms of their care journey. I would also say that, we have to think about our patients/members holistically. So we shouldn't be focusing in on one disease. We should be focusing in on if that person has comorbidities, if that person has gaps in terms of social determinants of health, behavioral health. Post-pandemic, I mean, the crisis of mental health, as it has never been before, is a pandemic in itself, right? So, really honing in on not just one disease or one condition or even that person's clinical picture, but we have to think more broadly in terms of that person holistically, right, and bring through those social determinants that have impact on their health outcomes, behavioral health, emotions, and and needs. So I would say that's very important, and that spans across both provider and member, and holistically, culturally, clinically, etc. Yeah.
So that brings us to the end of our time together, but I do want to say I always enjoy speaking with you and asking you questions because I learn so much from you, Amy, and I learn things that will help me make me better in my job and also allow me to help the customers that I'm out there serving. So I really, really thank you for joining us for this session and contributing to Patient Experience Week. Thank you so much.
Thank you all for watching. Please feel free to leave us questions or comments below, and check back soon for more content from the HLS industry team.